Today we will discuss on a topic candidiasis. Candidiasis is a disease which is caused by a fungi named Candida albicans. Candida is a genus name, whereas albicans it is its species name. In basically candidiasis or disease caused by Candida albicans. Candida albicans is an opportunistic fungi that is the cause of many undesirable symptoms leading to fatigue and pain. If we see the structure of Candida, it consists of blastospores, hyphae which are pseudo in nature, chlamydospores. It grows in several different morphological forms, ranging from unicellular budding yeast to true hyphae with parallel side wall. It's a unicellular, oval-shaped diploid fungus. It's a form of a yeast. It lives as a harmless commensals in the GIT, gastrointestinal tract, genitourinary tract, and are found in over 70% of the population. What do you mean by the word Candida? Candida is we have I have used the word Candida, fungus name. Uh, in general, we discuss Candida means the overgrowth of the fungus and yeast in the body, which flourishes when they got suitable climatic conditions, like they got moisturous condition, etc., and suitable temperature for their growth. Overgrowth, if the overgrowth of this organism occurs, then this will lead to diseases. If we see the structure of Candida albicans under microscope, then you can see here these are the blastospore, these are the pseudohyphae and chlamydospore, these are the spore condition, and these are the fungal forms. There are different types of candidiasis, there are 5 types of candidiasis. First is thrush. Thrush, a normal general we can see fungal growth on a tongue, generally referred as a oral thrush. The common name for a mouth infection caused by Candida albicans. It affects moist surfaces like around the lips, inside the cheeks, and the tongue and the palate. Common in people and generally affect those which have weakened immune system, like cancerous patients and AIDS patients. It can develop in normal immune system peoples too, but on those people affect only those people which are suffering from diabetes or long lasting irritation from dentures. Next comes esophagitis. Esophagitis, as its name suggests, esophagus, and infection in esophagus. If the growth of this fungus occurs in esophagus, or it travels from mouth to esophagus, it terms as esophagitis. Infection of the mouth can spread to esophagus, causing esophagitis. This infection is mostly common in AIDS and people receiving chemotherapy for cancerous patients. This is general diagram of a oral thread. You can see here there is a presence of fungal growth on tongue. Next comes cutaneous skin candidiasis. Candida can cause skin infections, including diaper rash in areas skin that receive little ventilation and are unusually moist. Some common sites include diaper area, hands of people who routinely wear rubber gloves, rim of skin at the base of the fingernail, especially those hands which are exposed to the moisture areas around the groin and skin fold under large breasts. You can see the presence of fungal growth on the nail side. Next comes vaginal infection. Vaginal infection is usually transmitted sexually. During a lifetime, 75% of women are likely to have at least one vaginal candida infection, and up to 45% have two or more. Women may be more susceptible to vaginal yeast infection if they are pregnant or have diabetes. The use of antibiotics or birth control pills can promote yeast infections, so can frequent touching. These you can see here. These are the redness present on the ear area. These are the pustules present in the area. The yeast infect the cervical canal of the vagina. Next come deep candidiasis. For example, Candida sepsis. Here word comes sepsis. Sepsis means when any bacterial growth transferred in or get mixed with bloodstream, then we can term the name as septicemia or sepsis. In deep candidiasis, Candida fungi contaminated a blood stream and spread throughout the body, causing severe infection. Especially common in newborns with low birth weights, and in people with severe immune system like AIDS patient and cancerous patient, or the person having severe medical problems. And those people's Candida fungi may get into bloodstream through skin catheters, tracheostomy sites, ventilation tubing, or surgical wounds. Deep candidiasis also occur in healthy people if candida fungi enter the blood through intravenous drug abuse, severe burns, or wounds caused by trauma. These are the general pictures of candidiasis, deep candidiasis. You can see here the red patches of cells on the skin. Now comes to symptoms. There are many symptoms for each and every types of candidiasis, and it depends on the site of the infection. Like thrush gives curd like white patches inside the mouth, especially on the tongue and palate and around the lips. Uh, if we try if we try to scrape off this whitish surface, we will get red inflamed area which may slightly bleed. There may be a cracked red moist area skin at the corners of the mouth. Sometimes thrush patches are painful, but often they are not. Next comes esophagitis. Candida esophagitis may make swallowing difficult or painful, and it may cause chest pain behind the breastbone. Cutaneous candidiasis causes patches of red, moist, weepy skin, sometimes with small pustules nearby. Vaginal yeast infections, it may cause following symptoms like vaginal itching, soreness, thick vaginal discharge with a texture like soft or cottage cheese, burning discomfort around the vaginal opening, especially when the urination time, pain or discomfort during sexual intercourse. Deep candidiasis spreads to the bloodstream and may cause a wide range of symptoms. First one is the unexplained fever to shock and multiple organ failure.